Welcome to the presentation on evaluating decision-making and relationship competence when reporting suspected child abuse and neglect. My name is Dr. Lee Tufford. I would like to acknowledge that Laurentian University, the University of British Columbia, the University of Toronto, and the University of Calgary all sit on unceded territory. I would also like to acknowledge the generous support of multiple funders, including the Enkin Program in Simulation at the Factor in Wentish Faculty of Social Work, University of Toronto, the Social Sciences and Humanities Research Council Insight Grant Program, and Eric and Diane Axford of Calgary, Alberta. These are the members of the research team. They are myself, Dr. Lee Tufford. I am the principal investigator on the study and a professor in the School of Social Work at Laurentian University. My co-investigators are Dr. Barbara Lee, who was an assistant professor in the School of Social Work at the University of British Columbia, the late Marion Bogo, who was a professor in the Factor in Wentish Faculty of Social Work at the University of Toronto, and Dr. Elizabeth Wenghofer, who was a professor in the School of Kinesiology and Health Sciences at Laurentian University. I would also like to acknowledge Dr. Angelique Jenny, who was an associate professor in the Faculty of Social Work at the University of Calgary, the OSCE raters and research assistants in Ontario and British Columbia, the Michener Institute in Ontario, CIMED in British Columbia, the Jack Bell Building, which houses the School of Social Work at the University of British Columbia, and all the participants who gave of their time and knowledge to the study. Before beginning, I would like to note that this presentation discusses child abuse and neglect. The content may be difficult for some viewers. Please engage in self-care as needed. I would also like to note that the term parent or parents is used in the presentation, and this term includes foster parents, caregivers, or guardians. This presentation is divided into 3 sections. Section 1 is entitled Mandatory Reporting of Suspected Child Abuse and Neglect in Canada. Section 2 covers decision-making factors and reporting suspected child abuse and neglect. And Section 3 focuses on maintaining the therapeutic relationship when reporting suspected child abuse and neglect. Before beginning the presentation, please stop the recording and discuss the following questions. Have you ever suspected child maltreatment had occurred or was presently occurring? Who amongst you has called Child Protection Services? What was the experience of calling Child Protection Services like? What happened to your relationship with the client as a result of calling Child Protection Services? In Section 1, I will discuss the mandatory reporting of suspected child abuse and neglect in Canada. Canadian child welfare legislation grew from the concept of parens patriae, a Latin term for protector or father of the country, whereby the court may substitute as a benevolent parent on behalf of the state. Although interventions originally focused on enforcing standards of care as opposed to the caring aspects of parenting, the parens patriae framework served to inform Ontario's 1893 Act for the Prevention of Cruelty to and Better Protection of Children, and the 1908 Federal Juvenile Delinquents Act. The Juvenile Delinquents Act was designed to protect children or others from their or others' evil tendencies through providing state representatives to offer guidance and assistance. Juvenile and family court judges were charged with the responsibility of acting in the role of the benevolent parent on behalf of the state and making decisions for the child's best interests accordingly. Amendments to provincial child welfare and federal juvenile delinquents acts throughout most of the 20th century were based on the concept of parens patriae, which provided the state with the right to remove some authority from the family, define good and bad parents' behavior, articulate safe living conditions for children, propose possible outcomes for young persons involved, and establish services for children believed to be in need of state intervention. In Canada, child welfare falls under provincial and territorial jurisdictions. With the enactment of child welfare legislation arose the establishment and growth of child protection services and provincial departments of child welfare. Early legislation did not concern itself with societal issues of poverty, exploitation of children, or other social issues, which resulted in neglected, abandoned, or maltreated children, but did enforce that parents no longer have the right to absolute power over their children. Child welfare legislation continued to expand and refine in scope throughout the 20th century. In the 1960s, provinces and territories began introducing mandatory reporting legislation, and since 1980, every province and territory has enacted some form of this legislation. Legislation differs across provinces and territories in the definition of child maltreatment. At the federal level, the Public Health Agency of Canada states child maltreatment refers to the harm or risk of harm that a child or youth may experience while in the care of a person they trust or depend on, including a parent, sibling, other relative, teacher, caregiver, or guardian. Harm may occur through direct actions by the person, acts of commission, or through the person's neglect to provide a component of care necessary for healthy child growth and development, or acts of omission. This map of Canada shows that the responsibility for protecting and supporting children at risk of abuse and neglect falls under the jurisdiction of the 13 provinces and territories. There does not exist a single unified system of child welfare. Each province and territory are a separate jurisdiction. This slide shows that the age of protection, or what is considered a child, differs from province to province and territory to territory. This can be even more nuanced within provinces. For example, the province of Prince Edward Island views a child as a person who is under 18 years of age. However, in adoption cases, Prince Edward Island views anyone under the age of 21 as a child. The slide also shows the legislation per province and territory. It is also important to note that legislation is amended from time to time. For example, in 2018 in Ontario, the provincial government at the time amended the age of a child from 16 to 18. These are the major classifications of maltreatment. Physical maltreatment involves actions such as shaking, pushing, grabbing, throwing, hitting with a hand, punching, kicking, biting, hitting with an object, or other forms such as choking, strangling, stabbing, burning, shooting, poisoning, and the abusive use of restraints. Sexual maltreatment involves acts of physical contact, including penetration, attempted penetration, oral sex, fondling, sex talk, voyeurism, exhibitionism, exploitation, inappropriate touching of genitalia, as well as those of non-contact, including exposure to pornography or sexual acts. Neglect includes omissions in care by parents resulting in significant or the risk of significant harm and involves failing to provide for a child's basic needs. Basic needs can include food, clothing, shelter, supervision, medical care, emotional care, education, psychological or psychiatric treatment, or a hazard-free home. Neglect is often found in families living at or below the poverty level who are struggling with economic issues to provide the basic necessities such as food. Emotional maltreatment has vague definitions due to a lack of specific incident or visible injury and tends to become apparent over time. This type of maltreatment includes threatening, belittling, or defamation, inadequate nurturance, affection, invasion of privacy, negligence, and exposure to intimate partner violence. Exposure to intimate partner violence is an addition to mandatory reporting legislation in the Canadian context and involves a child either directly witnessing violence between parents or indirectly witnessing the violence, such as through seeing the physical injuries on the parent or overhearing the violence. At the time of this recording, 7 jurisdictions have included exposure to intimate partner violence as a circumstance where a child is in need of protection. These are Newfoundland and Labrador, Alberta, Manitoba, the Northwest Territories, Nova Scotia, Prince Edward Island, and Saskatchewan. Ontario does not currently have this legislation. However, these cases are processed as child protection services based on the Ontario Child Welfare Eligibility Spectrum and some municipal police protocols. These child maltreatment categories should be analyzed within the context of the family's circumstances. For example, neglect may have a different meaning and may appear differently for a child aged 4 as opposed to an adolescent age 14. Neglect may also have a different meaning for a middle-class family as opposed to a family living below the poverty level. Mandatory reporters are persons required by provincial and territorial law to report suspicions of child abuse or neglect. Research has shown that reports from provincial sources, from professional sources, tend to be substantiated at higher rates than non-professional sources, which would include friends, family, and neighbors. There is a wide range of occupations which are mandatory reporters, including medical professionals, mental health professionals, educational professionals, members of the clergy, employees of the justice system, and occupations specific to children and youth. Child protection services operate 24 hours per day, 7 days per week. Some child protection services provide only child protection, while others provide broader child welfare services such as counseling. Child protection services decide the urgency of the situation and timelines for responding. These timeframes refer to the level of threat to the child, as well as the child's age, health status, and exposure to forms of maltreatment. Child protection services will also decide on the type of intervention. Despite the fact that mandatory reporting legislation is provincially and territorially directed, all registered social workers practicing in Canada are governed by the Canadian Association of Social Workers Code of Ethics, Values, and Guiding Principles. The code speaks to mandatory reporting and the limits of confidentiality at various points. For example, Guiding Principle 1.7 states social workers uphold the rights of every person, group, and community to be free from violence or threat of violence. Guideline 1.7.3 states being knowledgeable about the signs of physical, emotional, and sexual abuse and the sexual exploitation of children and youth, and taking the necessary measures to protect their safety and well-being, and, where circumstances require, fulfill their professional duty to report specified under child protection legislation in their jurisdiction. As well, in terms of confidentiality, Guiding Principle 6.3 states social workers are transparent about the limits of confidentiality in their professional practice. Social workers inform service users of the limits to privacy and confidentiality related to the individual rights of children and adolescents, couples, families, or groups sharing information in service provision, which may or may not be respected by all. In addition to being governed by the Canadian Association of Social Work Code of Ethics, social workers are also governed by the provincial or territorial college or association. This slide shows the name of each college or association in Canada along with the Code of Ethics for that regulatory body. Social workers are strongly encouraged to read through the Code of Ethics for their college or association once per year to remind themselves of their ethical obligations. I would invite you to pause the presentation and discuss the following questions. What information did you already know? what was new information for you? How can this knowledge inform your practice? I will now move on to section 2, which discusses decision-making factors in reporting suspected child abuse and neglect. Despite the obligation to report child abuse and neglect, research has shown that there are many reasons why reporting does not occur, and some are listed here. These reasons involve not knowing how to report, concerns over losing the relationship, previous negative reporting experiences, and worry over the impact of reporting on the child and family. Reporting child abuse and neglect is a challenging issue for many mandatory reporters. This is a mandatory reporting framework, which was based on my doctoral research conducted at the University of Toronto. During my doctorate, I focused on decision-making and therapeutic relationship strategies when reporting child abuse and neglect. Specifically, I conducted an online survey of the Ontario Association of Social Workers, gave them vignettes of child abuse and neglect, and asked Likert scale questions regarding their decision-making. I then asked open-ended questions on how they maintained the relationship. What emerged from this research was the framework I have here on this slide. The framework begins at the top with proactive strategies prior to the disclosure of reportable material. These strategies include explaining the limits of confidentiality, signing an informed consent statement, and building the relationship prior to the disclosure of reportable material. From these initial strategies, the framework proceeds to outline the decision-making factors to consider when faced with suspected child maltreatment. These include legal, mandatory reporter, situational, professional, and relationship factors. Based on these discrete but interrelated factors, the mandatory reporter decides to report or not report to Child Protection Services. In the event of reporting, the family may have a positive or negative reaction to the report or somewhere in between. A positive reaction could include that the family feels heard and understood and is appreciative of the report. A negative reaction could include that the family feels afraid, angered, and betrayed by the mandated reporter. This could then lead to the relationship becoming strained and tense and possibly resulting in the family withdrawing from treatment. In the event that the family's reaction is negative, the mandatory reporter can draw from a number of relationship repair strategies, specifically reporting, information, affect regulation, advocacy, resource, and cultural strategies. Emerging from these strategies is the impact on the relationship, which can be maintained or strengthened, leading to continued treatment. In presenting this framework, I want to add that some viewers may have been trained to not tell the client they are reporting, or that their workplace policy is not to tell clients, while other viewers may have been trained to discuss reporting with the client prior to doing so. The framework is predicated on discussing the report with the client, but this may not be the case for all viewers. However, the relationship repair strategies can still be useful for mandatory reporters who did not discuss reporting with clients prior to filing the report. Beginning at the top of the framework, in terms of the proactive strategies to avoid potential relationship rupture, the first strategy involves explaining the limits of confidentiality, which will look different depending on the geographic region. When explaining the limits of confidentiality, it is recommended to discuss the different types of abuse and neglect, namely physical, sexual, emotional, intimate partner violence, and neglect. This lets the client know that there are different types of abuse, as often clients may think of only physical abuse. It is also important to discuss any legal reasons why you cannot keep confidentiality. For example, there may be situations where you have to turn over your client notes to a lawyer for court proceedings. There may be other situations where you cannot maintain confidentiality. For example, in Ontario, if a client says they are being treated in an unethical manner by a regulated healthcare provider, such as an occupational therapist, physiotherapist, teacher, or doctor, the mandatory reporter is obligated to contact that professional's college. Should the client have any questions about any aspect confidentiality. Their questions of the social worker's responses should be documented and remain in the client file. The second strategy is informed consent. This involves asking a client to sign an informed consent statement that would have the limits to confidentiality, as well as other information such as fees, cancellation procedures, etc. Some clients may not feel comfortable signing an informed consent statement and may wish to give oral consent. In this situation, it is important to document that the informed consent statement was explained in detail and that the client chose not to sign but give oral consent. The final strategy involves beginning to form the therapeutic relationship with the client. This will be demonstrated in the simulation videos, which are part of the educational toolkit. Building the relationship can take place by asking how the client is doing, expressing concern for their well-being, offering condolences when loss has occurred, and treating them not just as a parent, but as an individual. It is important to remember that most clients are trying to parent the best they can under challenging circumstances such as inadequate housing, poverty, disability, illness, and bereavement. This slide focuses on the decision-making factors, specifically legal, mandatory reporter, situational, professional, and relationship. I will discuss each factor in detail. As I talk about each factor, see if you can identify which factors you use in your decision-making and which factors tend to impact your decision-making. Legal factors are at the macro level and pertain to provincial and territorial child abuse and neglect legislation. The first legal factor is knowledge of mandatory reporting legislation. This legislation varies from province to province and territory to territory. As noted earlier in the presentation, there does not exist a single unified system of child welfare. Definitions of maltreatment range from broad and general to narrow and specific. Previous research has shown that clarity of a professional's legal requirement was most strongly related to the likelihood of reporting child abuse and neglect. Still under the legal factors is ambiguous legislative language, which may confuse mandatory reporters as to what constitutes reportable behavior. Vaguely worded statements may lead to underreporting or overreporting. Examples include reasonable suspicion, cause to believe, reasonable cause to know and suspect, maltreatment, and neglect. This leaves discretion to the mandatory reporter. Still within the legal factors is the agreement with mandatory reporting legislation. Social workers may agree or disagree with mandatory reporting legislation. In my dissertation research, participants who did not agree with their legal obligation as a mandatory reporter were less likely to report child maltreatment. The final legal factor is college or association. This refers to the fact that social workers must be part of a provincial or territorial college or association. Colleges or associations may have a code of ethics to guide professional behavior with regard to issues of confidentiality, informed consent, and how mandatory reporting of child maltreatment. This concludes the legal factors in the framework. I would encourage you again to reflect on your decision making and how factors such as knowledge of mandatory reporting legislation, legislative language, agreement with mandatory reporting legislation, and college and/or association requirements impact your decision making with respect to mandatory reporting. I will now move on to the next factor in the framework, which is mandatory reporter factors. These are factors about the mandatory reporters themselves, which can lead to biased reporting decisions. It is important that mandatory reporters reflect on these factors and acknowledge if one or more of them is impacting their decision making. Disciplinary history refers to how the mandatory reporter was disciplined while growing up. The experience of hearing a child or adult recount a disciplinary experience within a professional capacity is likely to generate reflection and possible emotional response regarding one's own disciplinary history. The relationship between how adults were disciplined during their formative years and their beliefs about discipline and maltreatment is complex. For example, a mandatory reporter who experienced a type of punishment as a child is more likely to feel that this type of punishment is appropriate and approve of its use unless their appraisal of the experience is negative. So think of corporal punishment. Many mandatory reporters received corporal punishment when they were growing up. If you thought corporal punishment was normative because it happened to you and your friends, and it did not seem abusive or harsh, there is a tendency to evaluate this form of discipline as appropriate. But this may have some impact on the likelihood of reporting. Social workers with higher scores for approval of corporal punishment were less likely to report child maltreatment. This may be problematic as mandatory reporters may be required to report behaviors they experienced and labeled as appropriate forms of discipline. This is very much an individual value judgment, where parental behavior considered to be serious by one mandatory reporter may not be viewed as serious by another. The next category within the mandatory reporter factors is the ability to manage conflict. A mandatory reporter who experiences difficulty managing conflict and who thinks a parent will become angry and threatening may be more hesitant to inform this parent that a report will be made, despite having the best of intentions to maintain the relationship following the report. The next category within the mandatory reporter factors is history with child protection services. This refers to mandatory reporters who were involved with child protection services while growing up and how they were impacted. A positive experience with child protection services may lead to a willingness to report child maltreatment, whereas mandatory reporters with poor experiences may be more reluctant to report. Attitude towards child protection services refers to mandatory reporters' opinions towards the functioning of child protection services. Some mandatory reporters do not report due to concerns regarding child protection workers' perceived inadequacy to conduct thorough investigations, take reports seriously, and protect other children residing in the home. Previous reporting experiences can foster the development of certain attitudes and an opinion regarding the functioning of child protection services and may influence a willingness to report. Gender may also factor into the decision-making process. However, the evidence is contradictory. Some studies show being female is a significant predictor, while other studies indicate it does not factor into decision-making. Parenthood is the next factor. Parenthood refers to the social worker status as a parent. Parenting one's own child may surface discipline issues previously unconsidered and may lead to opinions about what constitutes acceptable or unacceptable parenting practices. The evidence, however, is contradictory. Some studies show parenthood being a significant predictor in reporting suspected child maltreatment, while other studies, including my own, do not support this. Similarly, mandatory reporters' decision-making can be impacted by cognitive errors, also known as mental shortcuts. I will give you an example. One mental shortcut is called the affect heuristic, which involves an increased tendency to remember images and experiences which are disturbing, vivid, and negative. These are given more weight than images or experiences which are positive. Negative experiences of calling child protection services will stand out in the minds of mandatory reporters more vitally than positive experiences and may impact decision-making. This concludes the mandatory reporter factors. We now move to the situational factors in which the maltreatment occurs. This is the third box in the decision-making factors on the conceptual framework. The characteristics of a child or family can influence mandatory reporters. Some of the more common characteristics are age and socioeconomic status. For example, younger children are more likely to be victims of maltreatment than are older children. In terms of socioeconomic status, it is well documented that children from poor families are overrepresented in the child welfare system. Low socioeconomic status is often related to living below the poverty level, having inadequate housing, and/or receiving assistance from social services. This may increase the likelihood of contact with mandatory reporters. The factor maltreatment specifics refers to information around a disclosure, such as the type of maltreatment, who was involved, what occurred, how did the child and parents react, what happened afterwards, and were objects used. In seeking these details, mandatory reporters gain a fuller understanding of the maltreatment scenario and then utilize their professional judgment to make the best decision. Research has shown, however, that sexual maltreatment is more likely to be reported than other forms of maltreatment. Injuries that are of a severe nature are more likely to be reported. Maltreatment described as presently happening is more likely to be reported than maltreatment described as occurring in the past. And an injury that is not consistent with the history or child's developmental level is more likely to be reported. The factor certainty of maltreatment concerns the mandatory reporter's level of certainty that maltreatment has in fact occurred. Research has shown that reporting increases when the child has signs of maltreatment, such as in physical abuse, and that severity of abuse and actual proof lead to a stronger reporting record, whereas the perception of a lack of evidence may lead to non-reporting. In addition, given that a disclosure of child maltreatment can take place without the child present, the dilemma for mandatory reporters is to make a decision concerning the welfare of the child in the absence of actually seeing or interacting with the child. Some reporters do not report and instead wait for additional evidence to appear to confirm if the situation warrants reporting. However, waiting for additional evidence is problematic, as legislation requires the reporting of a suspicion of child maltreatment and not evidence that it has occurred. Finally, with regard to culturally based disciplinary practices, parents immigrating to Canada may engage in discipline related to their culture, which may be considered harsh compared to those practices in Western society and may be viewed as maltreatment. It can be challenging for mandatory reporters to distinguish between culturally based parenting practices while factoring in legal reporting obligations. However, the obligation of mandatory reporters overall is to keep children from any culture free from present or future harm. My research did not show a consistent result that ethnicity of parents was a significant predictor in the decision to report suspected child maltreatment. This concludes the situational factors. Professional factors refer to the mandatory reporter's professional life. The first factor is mandatory reporters' work experience. Research has shown that mandatory reporters with more work experience were more likely to report to child protection services and were less concerned with the potentially negative consequences. More work experience leads to more accurate assessment of the physical and emotional state of children. Mandatory reporters with less work experience were more concerned with potentially negative attitudes by parents and were less likely to report. However, other research has shown that professionals with longer practice histories tended to not report. These latter professionals may be more cynical about their ability to intervene successfully in a case of suspected child maltreatment. A second professional factor is training in the recognition of child maltreatment. Many mandatory reporters receive training during in-service opportunities, staff meetings, and webinars. Training can lead to improved recognition and reporting of child abuse, how to identify types of abuse, how to work with families affected by abuse, and a better understanding of child protection services processes, while lack of training can be a barrier to reporting. Research has consistently shown that training in child abuse and neglect identification can lead to increased reporting. The next professional factor is field of practice. There is a lack of research on how a social worker's field of practice, such as hospital social work or children's mental health, impacts the decision to report suspected child maltreatment. Research tends to focus on the distinctions between mental health professionals, such as social workers, psychiatrists, and psychologists, and not between the fields of practice within each profession. My research examined the decision to report based on the social worker's field of practice. including medical-related practice, community-related practice, child-related practice, and private practice. My research did not find that field of practice was a significant predictor in the decision to report suspected child maltreatment. However, one researcher found that physicians do report more than nurses. The factor reporting history may affect mandatory reporters' decision-making. Research has shown that reporting, which results in stopping the maltreatment, may increase the likelihood of future reporting. However, negative reporting experiences that end therapy prematurely are likely to result in decreased reporting. Some of you may have heard that the human brain has a negativity bias that looks for and stores negative experiences. The brain is said to be Velcro for negatives and Teflon for positives. Our brain remembers negative experiences much more than positive experiences, and this may impact the decision to report. Think of the affect heuristic I described on the earlier slide. If the last 3 times you reported were very negative experiences, these will tend to stick out in your mind and may affect future reporting decisions. The next factor is consultation or supervision with peers, a supervisor, or members of an interdisciplinary team. My doctoral research showed that the opinion of colleagues was the top factor, influencing decision-making to report suspected child maltreatment. Peers can play a meaningful role in assisting and guiding colleagues to appropriate and professional decision-making. The final professional factor is the mandatory reporter's workplace. In many occupational settings, employment policy dictates that suspicions of child maltreatment must be discussed first with a supervisor or interdisciplinary team. In addition, increased workplace support leads to strong reporting tendency. Employment policies may differ from context to context. When starting a new place of employment, mandatory reporters are advised to familiarize themselves with the reporting requirements within their organizational context. Mandatory reporters often have lengthy relationships with clients. Think of occupations like doctors, teachers, or school principals. These relationships can span years. Moreover, in rural or remote parts of Canada, there may not be another doctor or social worker clients can see or another school to attend. Mandatory reporters are often concerned about the impact on the relationship, clients having decreased trust of their social worker or terminating the relationship altogether, which leaves mandatory reporters in the position of not being able to intervene to prevent future maltreatment. Some professionals fail to report because they are afraid of affecting the therapeutic relationship. Research has shown that clients had been in treatment for roughly 3 months prior to the disclosure of child abuse or neglect. Thus, mandatory reporters may have formed powerful therapeutic relationships with their clients. Therapeutic relationship outcome studies in cases of mandatory reporting have consistently shown that roughly 1/4 of cases were classified as having a negative outcome. Negative outcomes may include termination, missed appointments, lateness, client expressed anger, or threatened violence during a session. Please take a moment to turn off the recording and discuss the following questions. Which factor or factors impact your decision-making the most? Which factor or factors impact your decision-making the least? Are there additional factor or factors you had not considered prior to this presentation? We are now moving into the third section of the presentation, which concerns the therapeutic relationship. The social work relationship is based on collaboration and mutual respect. The bond, goals, and tasks are integral components of the relationship. The relationship is also a strong predictor of treatment success across many therapeutic models. Engagement begins in the first meeting with the client, whether that is in person, through the phone, via email, or on an electronic platform. Engagement is ongoing. Despite our best attempts to engage and maintain the relationship, ruptures are commonplace and can emerge from both social workers and clients. Ruptures may vary in intensity, duration, and frequency and may go undetected by either social worker or client. It is the social worker's responsibility to detect relationship ruptures and address them in a straightforward but sensitive fashion in order to reestablish a therapeutic relationship with the client. In my doctoral research, I asked social workers what the initial impact of reporting suspected child maltreatment on the therapeutic relationship was. Social workers noted both positive and negative feelings to a child protection services report. Some of the positive feelings included being relieved, validated, and appreciative of the support, and the client understands the reason for the report. Social workers also reported negative feelings to a child protection services report. Some of the negative feelings included anger, defensiveness, anxiety, fear, shame, suspicion, feeling violated and judged. In the event of a negative reaction, the relationship can become strained or tense, and the family may withdraw from treatment. I am going to return to the framework I presented earlier. Should the relationship become strained or tense, mandatory reporters can draw from a number of strategies to maintain or repair the relationship. These are grouped into reporting, information, affect regulation, the mandatory reporter, affect regulation of the family, advocacy, resource, and cultural strategies. As I am reviewing the relationship strategies, see if you can identify which strategies you use in your occupational context. Reporting strategies involve how the report is made to Child Protection Services. It is important to first note the Canadian law does not require mandatory reporters to inform the client prior to making the report. Some mandatory reporters, however, may choose to discuss the duty to report with the client before reporting or tell them afterwards to remove a sense of betrayal. Mandatory reporters may also try to involve the client in the reporting process, and there are several ways to involve the client. One way is to have the client present while you call Child Protection Services. Another option is to encourage clients to self-report with you present or having stepped out of the room. A third option is for you and the client to call together. These options promote transparency, allow the client some control over the reporting process, and reduces the sense of isolation felt by the client. And there are many information strategies. Revisiting the signed consent form from the start of treatment can remind clients of the original agreement and the obligation to report suspected child maltreatment. Mandatory reporters can also provide important information to clients about child protection services, such as the process of reporting and the process of a child protection services investigation, and that the protection worker may come to the residence. However, this last point is not akin to coaching clients on what to say to child protection services should an investigation occur. Mandatory reporters can also explain the role of child protection services as a protector of children, as well as the benefits of involvement in child protection services, such as in-home assistance with parenting struggles. It is important to note that not all child protection services across Canada offer these services to families. But for those which do, this may help parents see child protection services in a supportive rather than punitive light. Mandatory reporters can maintain contact with child protection services throughout the process of an investigation and support clients. Finally, mandatory reporters who work in the mental health field may offer psychoeducation to clients to assist them in deepening their familial connections, decreasing shame, and exploring how family of origin disciplinary practices impact present disciplinary decisions. Mandatory reporters may feel intense negative feelings after reporting to Child Protection Services, as well as when facing families' anger. In order to stay focused and calm, it may be helpful to explore these negative feelings with a colleague or supervisor. By remaining composed and attuned to one's feelings in the face of a client's emotional reaction, mandatory reporters may help the client to downregulate, thus promoting dialogue and the management of negative emotions. In addition to practicing affect regulation strategies of a personal nature, reporters can assist families to regulate their own intense negative emotions. Mandatory reporters can explore and validate families' feelings of shame, fear, blame, and anger, which helps the family to realize that these negative feelings are to be expected. Mandatory reporters can also openly and directly acknowledge the impact of reporting on the relationship in terms of trust. Validating parenting struggles is also a means by which parents can feel heard and understood by the mandatory reporter. During the investigation process, mandatory reporters can try to maintain contact with the family by reaching out to them via telephone or asking the family to attend further sessions. This shows interest in their well-being and reduces feelings of abandonment and judgment in the investigation process. If possible, mandatory reporters can meet the Child Protection Services worker and the family together to demonstrate transparency, and so the family can hear them communicate openly with the investigation worker. In terms of advocacy strategies, when children are maltreated, they often need a mandatory reporter to advocate on their behalf. One advocacy strategy is to express concern for the child's safety and well-being. Mandatory reporters need to be transparent with the reality of how the child is being treated or what is lacking in the child's care. Second advocacy strategy is to reinforce parenting skills and strengths. Mandatory reporters can remind parents of times where they have shown strength in handling difficult situations with their child. Finally, a third advocacy strategy involves advocating on behalf of the family with Child Protection Services. Mandatory reporters can reassure parents that the fact that they are seeking help speaks volumes about their strength as a family, and that this message would be shared with Child Protection Services. Mandatory reporters may find that parents lack the necessary resources to appropriately and safely look after their children. It is important to ask if extended family, friends, or neighbors could assist in helping parents take care for their children. Community supports such as food banks, clothing depots, walk-in medical services, or interim housing may be a means of providing concrete necessities the family may not currently possess. Mandatory reporters may also have a network of professional supports that could assist families. In a situation where the parents are too upset about the report to continue working with the mandatory reporter, offering families the option of working with another professional may keep the family engaged in treatment. However, this can be more challenging in rural or remote communities where there are fewer social workers available to service clients. Some families, particularly those who are new to Canada, may not be aware of mandatory reporting legislation and that the laws governing the treatment of children may be entirely different from those in their home country. Explaining mandatory reporting legislation and acknowledging possible cultural differences in the views of discipline may help clients to understand accepted disciplinary practices in Canada. Other strategies that are mindful of culture include referring families to culturally specific resources, whereby the family could begin to develop a social support system. Another strategy involves consulting with a colleague or supervisor knowledgeable of the client's culture, particularly as it relates to disciplinary strategies specific to that culture or to cultural norms or expectations. Reporters may utilize the services of a translator when faced with significant language challenges. Mandatory reporters are encouraged to practice cultural humility and receive training in anti-oppressive and anti-racist strategies. Finally, it is important for mandatory reporters to build relationships with cultural organizations. These strategies have been presented in a discrete fashion. However, in actual practice, you would use these strategies in tandem. For example, when discussing various reporting options with the family, you could also validate their feelings of shame and fear. Lastly, it is important to think about what the specific family needs in terms of assistance, and to do this in a purposeful fashion. This concludes the relationship repair strategies. Through using the various relationship repair strategies, hopefully this will have a positive impact on the relationship. It will become stronger and the family continues in treatment. Please turn off the recording and discuss the following questions. Which strategies do you currently use? Which strategies are beneficial for your population? How effective are these strategies? Are there additional strategies you could use? I have presented the decision-making and therapeutic relationship strategies as discrete factors, but want to show you how they are woven together when working with a client. There are 3 simulation videos in this educational toolkit. If you click on the tab Simulation Videos, you will see a video on physical abuse, one on intimate partner violence, and one on neglect. The relationship repair strategies appear at the bottom of the screen. As you watch each video, ask yourself the following questions. What factors do you include in your decision making? How are you feeling? How do you think the client is feeling? What, if anything, would you do differently? What was new learning for you? Just a note that if the presentation was triggering, please engage in self-care as needed. Thank you again for listening to this presentation.